Cynthia Myrick, birthday 11/23/60. I give Elena Myrick permission for this health to record this health assessment for educational purposes.
Hello, my name is Elena and I'm going to be your student nurse today.
Hello.
Can you tell me your name and birthday while I take a look at your wristband?
Cynthia Myrick, 11/23/60.
All right, Miss Myrick. So I'm going to ask you a few questions to start off with this assessment. Can you tell me where we are at right now?
At our home.
All right. And can you tell me what day of the week it is?
Saturday.
All right. Can you tell me who the President of the United States is?
Donald Trump.
All right, perfect. So your mood is pleasant and you are alert and oriented times 3. Now, are you having any pain right now, Miss Myrick? With 0 being no pain at all and 10 being the worst pain that you can imagine?
0.
All right, so good. No pain noted. All right. Now, do you use any type of mobility devices such as a cane, crutch, wheelchair, or walker?
No, I don't.
All right. And any special equipment that you use, such as a SCD, which is a compression device to help with swelling in the lower extremities?
No, I don't.
All right. Do you have a special mattress at home?
No.
Okay. Do you use any oxygen?
No.
All right. And I do not see any IV lines, any sort of ostomies or dressings. Is that correct?
That's correct.
All right. Perfect. So now I'm just going to start off with your vital signs. All right. So I'm going to grab my stethoscope. I'm going to... Can you stretch your arm out for me? Thank you. All right. So if I was to actually take your vitals, I could tell what is normal and abnormal. So as example, a normal blood pressure reading is between 90/60 and 120/80. A normal temperature is between 96.8 and 100.4. A normal pulse rate is between 60 and 100. A normal respiration rate is between 12 and 20. And a normal oxygen saturation is between 95 and 100. And your vitals are within normal limits. All right, so to get started on this respiratory assessment, Miss Myrick, do you by chance have asthma?
No.
Okay, do you smoke?
No.
All right, you ever worked in a factory with any type of pollutants or anything like that?
No.
Okay, and any trauma to the respiratory region, your
No.
chest area? No? Okay, perfect. All right, so I'm going to go ahead and, first, I'm going to look at your fingers first. So if I can see your hands, I'm going to do them this way. And what I'm looking for is what's called clubbing. Clubbing is an enlargement of the fingertips and can indicate a chronic respiratory illness. Miss Myrick does not have any clubbing noted, which is good. Now I'm going to assess your breathing. And just by looking at you, it looks like that your breathing pattern is at a regular rate and rhythm. Your breathing is unlabored, which means that you are not using any type of accessory muscles to help you breathe, which is a good thing. And breathing patterns can, of course, be labored or unlabored. All right, perfect. So now, again, looking at your breathing pattern, I'm also going to look at your thorax. Now, a normal chest is twice as wide as it is deep. For normal people who do not have any type of respiratory illnesses, as opposed to what's called a barrel chest, which is a more rounder chest, which you do see in people with chronic respiratory illnesses. All right, so you don't have a barrel chest, your thorax is symmetric. Good. All right, so now we're going to get started with the touching, the feeling, and the listening of your chest region, Miss Myrick.
Okay.
So the first thing that I'm going to start off with is I'm going to what's called palpate the chest region. So as I'm doing this, just let me know if you have any pain or tenderness, okay?
Okay.
All right. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right. And can you turn around for me, Miss Myrick? All right, so same thing. Let me know if there's any pain. 3, 4, 5, 6, 7, 8, 9, 10. All right, you can turn back around for me. All right. Did you note any pain or tenderness, Miss Myrick?
No.
Okay, so no pain or tenderness noted, and I also did not feel any indication of a mass, which is good. All right, so now what I'm going to do is I'm going to percuss your chest region. I'm going to do the same thing like I did before. 10 on the front, 10 on the back. 1, 2, 3, 4, 5, 6, 7, 9, 10. All right, and turn around for me once again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, and you can turn back around for me, Miss Myrick.
Okay.
All right, and as I percussed your lungs, I was looking for what's called resonance sounds, which are low-pitched, hollow, drum-like sounds, which we heard in all fields, which is good. All right, now one of the last things I'm going to do with your lung region is I'm going to actually auscultate or listen to your lungs.
Okay.
So I'm going to use the diaphragm of my stethoscope as I do this. And as I'm doing this, when I move my stethoscope, Ms. Myrick, if you can just take a deep breath in and out. So we're going to demonstrate it. Perfect. So every time I do that, just do the same thing, okay?
Okay.
All right. Perfect. And can you turn around for me? All right. Now I'm just going to do the same thing. All right, perfect. You can go ahead and turn back around for me. All right, so what I was listening for was normal breath sounds. Abnormal breath sounds would be what we call adventitious sounds. And they can range from crackling or wheezing or what they call ronchi, which is more of like it can resemble like a rattle. Or a pleural friction rub, which would kind of be like what you imagine like if you was to rub like cement. Or something like bricks. So no adventitious sounds noted, which is good. All right, now the final thing that we are going to do for our respiratory assessment today, Ms. Meyer, is I'm going to check your lung expansion. So if you can just turn around for me once again.
Okay.
All right, and what I'm going to do, I'm going to place both of my hands on your back. And what I'm going to be looking for is to know that your lung expansion is equal and symmetric. All right, so if you can just take a deep breath in and out for me. And can you bend over just a little bit more for me? All right, perfect. And try again. Breath in and out. Perfect. Okay, so it looks like that your chest expansion is symmetric and bilateral, Ms. Meyer. You can go ahead and turn around. All right, and this concludes our respiratory assessment.
Okay. Thank you.